Turkey has reintroduced a series of coronavirus restrictions, including partial weekend lockdowns, in a bid to slow the surge of COVID-19 cases there. The Turkish President, Recep Tayyip Erdogan, saying a weekend curfew will be imposed between 8 p.m. and 10 a.m. Now, restaurants and cafes are allowed to serve takeaway meals only, while shops, markets and hairdressers only able to operate outside the curfew hours. We're going to cross then to Ankara. We're going to talk to our correspondent Jasper Mortimer, who joins us from there. Jasper, these measures appearing to many of us, perhaps here in Europe, for example, as rather tame still. Is the government there confident that they're going to be enough?
Well, the government would say it is, but the fact is, as you have just indicated, Stuart, that these are limited measures, and Turkish doctors say they will not be enough. The Turkish Medical Association wants the government to implement a full lockdown for at least 14 days. The Medical Association says hospital intensive care units are full. You've got to reduce the number of patients urgently, and the only way to do that is by taking drastic measures. Infections are rising too fast in Turkey. You know, in the 24 hours between Monday and Tuesday, according to the Minister of Health, 3,800 people contracted COVID-19 and 103 people died of it. Now, 40% of the infections are in Istanbul, the country's biggest city, and the mayor of Istanbul has been calling for a full lockdown. But this is where party politics interferes. The mayor, Ekrem İmamoğlu, belongs to the main opposition party. He's an enormously popular figure who could well challenge Erdogan for the presidency in 3 years' time. Erdogan does not want to be seen to be taking his cue from the opposition. So we've got a limited closure, as you said, restaurants on a takeaway basis, rather than the full closure that the Turkish doctors want.
Yeah, you talk about the Turkish doctors there, Jasper. I mean, they're really not happy, are they, about the whole way the issue's being handled there?
No, they're not. They've got numerous complaints, and let me just give you two of them. Firstly, they accuse the government of undercounting the death toll. Officially, 11,700 people have died since the outbreak began, but doctors suspect the real figure could be more than twice that. Now, the problem is that for a death to be recorded as due to COVID, the patient must have tested positive before they die. So if a person arrives desperately ill in hospital, at a hospital, he's treated, a test is done as soon as he arrives, but he dies hours after admission, and the test results only come in 24 hours after he arrived at the hospital. His death will be recorded as due to pneumonia, not as due to COVID. Then there are other patients who test negative, according to the swabs, but doctors can see from tomography scans that they've got COVID. They treat them as a COVID patient, but if they die, again, their deaths will not be recorded as a COVID death. The second thing that angers the doctors is that the government has refused to recognize COVID as an occupational disease. So if doctors and nurses die from COVID, their families will not get special compensation. And the government isn't doing this because it's short of funds. And 165 doctors, nurses, and technicians have died since the outbreak began.
Jasper, thanks so much. Jasper Mortimer, our correspondent there in Ankara.